We're going to get into some health news. There are plenty of headlines, of course, to cover. So let's get straight to Dr. Jessica Shepard, a board-certified OBGYN and Chief Medical Officer of HERS. Dr. Shepard, thank you so much. I always love having you. Let's start with this. According to a new study, over 500 hospitals have closed their labor and delivery departments since 2010. Rural hospitals have been impacted the most. I have covered this, worked with the March of Dimes as they were looking into this, gone to rural communities because it's something like 1 in 3 counties or something impacted by this. What is the reason and the impact, not just to new moms, because if it impacts moms, it impacts families and all of us?
Yeah, this is something that's going to impact communities. Again, like you said, not only moms and babies, but what we do see is when we look at the economics of a hospital and how it runs, we know that hospital administrators often consider that the revenue that they look at in labor and delivery units are often very high, and they have to find a way to be able to sustain this. So that also falls on insurance and what coverage that women are getting. And 40% of cases in pregnancy or pregnancy care is actually covered by Medicaid. And so when you look at actually the revenue that's generated from Medicaid or the care that's, that one would receive from Medicaid, that's where you see that imbalance, which a lot of times causes hospitals to not ever run in black and therefore having to close some of these labor and delivery units.
Dr. Shepard, I've done a lot of reporting on maternal mortality in this country, and I am taken aback by the fact that when we started talking about the closing of labor and delivery departments, you mentioned revenues, because that's part of the system. And then you go back to a segment that we just had like 5 minutes ago about the response that people are having to the death of a healthcare CEO on a street in Manhattan. And you look at these things and it's awful and it's wrong, but you see the real world impacts.
Yeah.
And it's just the fact that the maternal mortality rate in this country continues to rise, but we are seeing these labor and delivery departments closing. When you talk to other OBGYNs, how does that impact you and your colleagues? How do you feel that impacts your work?
It's actually very devastating. And when you look at the field of what we do, having to be available for emergencies that might happen overnight or having the ability to assess a woman at the time that she needs is never going to be at a certain time. Pregnancy really is this very short time frame in a woman's life. But that also comes with risk and very high risk. And that's exactly why we start to see this increase in mortality. But when we look at the other factors, that's what included in this pregnancy timeframe, we do have to do better, because when we impact maternal mortality rates, we are not only impacting just that mom and that baby, we are impacting communities and also the U.S. at large. And so there's such a ripple effect when we think of that there's this issue that could be actually cared for in a way if we did it responsibly, then that's where the devastation comes, especially for the practitioners that do these deliveries and in an emergency have to convert to a C-section and keeping mom and baby safe.
And so Dr. Shepard, I am putting you on the spot a little bit here, but how big of a problem is this in the country when it just comes to healthcare, insurance companies, health outcomes for Americans? As a doctor.
Yeah, we absolutely see how this has an impact in outcomes. And that's why we have to make a difference, because the actual care that people need, whether they're pregnant or not, really has a lot to do with the coverage, the access, and the ability for people to get care. And not only for the patients, but for physicians and healthcare providers themselves. They have to be able to work in environments that are able to sustain the care that's needed. And so you see at a system level how every stage of healthcare is impacted by this insurance coverage.
Dr. Jessica Shepard, thank you so much. There were so many other things we wanted to get to, and I was just taken by this one. Thank you for rolling with it. I appreciate you so much.